In a fast-paced world, not many people have the time to pause and enjoy the fruits of their labor. Feeling burnt out is easy, especially if your job is not fulfilling. That is why Dr. Yohann White says more workplaces need to create an environment where employees are able to function optimally.
Workplace wellness, or the more formal term for it is occupational health, is a well-developed field. There's a lot of research on best practices in the workplace, the strategies for promoting health in the workplace, and it also impact life outside of the workplace setting. Whereas in Jamaica, for example, there's only been recent efforts over the past few years to have, for example, a law that addresses, workplace wellness or safety and health issues for employees, for example, and that law is still, in the process of being formalized.
So what really is workplace wellness?
It's a comprehensive program that involves not just efforts to prevent the development of disease like chronic diseases like diabetes or hypertension, for example, or injuries or safety issues in the workplace, but it has to do with communication strategies, employee engagement so that employees feel like they're a part of a process, and it helps to shape the health promoting strategies in their environment that comes back to impact on their well-being and also their ability to contribute to the organization. It also encompasses involvement of the leadership of the organization. So it's a very comprehensive effort. It's not an ad hoc program where you have a marathon once per year, or you have a health clinic or a health fair once per year where your employees and their families line up, you do your blood sugar checks. A lot of effort is put into programs like those, but they may not be the best use of resources for an organization.
Dr. White says employers should pay closer attention to the mental wellness of employees.
When we talk about stress and mental health, those conditions have, unfortunately, a stigma to it, and that contributes to or not addressing those issues or being proactive with mental health issues. And it's a real challenge in the workplace. It's a real challenge in life. And a lot of it is related to stress. But a good or an effective workplace wellness program will have already thought about the needs, whether the stress levels in the organization or a particular unit. So by getting feedback from your employees about the challenges that they face on a day-to-day basis, if you truly do make the effort to engage your employees, then you'll get that feedback about the stressors that they face, what are the challenges that they face inside the workplace as well as outside the workplace. So even though you spend a significant, for some people, most of their life in the workplace setting, you also have to go home to your family, and what happens in the home can affect your performance at work, and what happens at work can affect your performance at home.
But workplace wellness programs aren't cheap, so is it really worth the investment?
Many organizations, as is the reality, will be concerned primarily about the money that these programs cost. But the evidence is clear that, for example, programs in the United States, for example, or companies that have won some kind of award or recognition for their workplace wellness programs and best practices actually perform better in terms of the stock valuation and dividends returns for their investors. So there's clear scientific evidence in publications that track the numbers that demonstrate that companies who have comprehensive programs leading to some form of recognition, either by a professional body or a state agency, for example, for their programs, actually do better.
Dr. White is therefore urging employers to get outside help to better evaluate the needs of their specific workplace.
If you really want to make a meaningful impact on your program and the health of your employees, then you want to get somebody who is objective, and that person can come in, help you with evaluating or doing a baseline assessment of your program, engage your employees, and then use these instruments such as from the HERO organization I just mentioned, or even from the US Centers for Disease Control and Prevention. They actually have a workplace wellness scorecard. So a health promotion specialist could help you to complete those measurement tools and to give you feedback on the state or the health of your organization in terms of your health promotion efforts, and help you to devise a program to fill those gaps.